Hello, my name is Rosie Metcalf, and I am one of the Rise Vermont program managers for Chittenden County in the University of Vermont Medical Center. Thank you for joining us for the Rise and Walk virtual edition. Through Rise and Walk, Rise Vermont is encouraging Vermonters to walk 30 minutes, 3 days per week, and hosting health talks featuring local professionals. With me today are Brittany and Sarah. Brittany Annis and Sarah Livingston both have their doctorates in physical therapy and are co-owners of Burlington Physical Therapy, where they focus on helping clients get healthy in order to perform better and thrive in the activities that they enjoy.
Hello, everyone. So today we're going to be talking about injury prevention and how you can go from not walking at all to being able to walk a 5K. So we're hoping to lay down a bit of a template for you to follow and also hone in on a few injury prevention tips. So first things first, as you're getting started, you're going to want some comfortable footwear. And we'd also like to point out, as you're getting going, try not to walk at your super comfortable pace. We call that, the all-day pace. So you want to pick something where you can still have a conversation, but you are a bit above what is your normal, comfortable walking pace. So Britt's going to take us through a few of the tips and tricks here.
For recommendations for starting, we definitely suggest maybe a 15-minute walk to start. Head outside and pick a loop that takes you, 8 minutes out and 8 minutes back to the house. Just trying to get moving. And we would also suggest maybe between 3 to 5 times a week. So starting at that 15 minutes, and then you can progress by 5 minutes per session, each week if you feel comfortable with that. So a good goal would be to get up to a 30-minute walk 3 to 5 times a week, and really just increasing by about 5 minutes per session, so you don't overdo it too quickly. We also recommend taking some rest days. So if you do 2 or 3 days of walking in a row, take another day as a rest and recovery day. Also just making sure you're warming up. Do something to get the heart rate up, get things moving, a little bit of dynamic movement stretching prior to your walk. And same thing for cooling down after you're walking. So, preventing muscle tightness and muscle soreness, just with some gentle stretching, for the muscles that you use when you're walking. Think your calf muscles, your hamstrings, and your quadriceps in the front and the back of your thighs. And, stretching out those muscles will really help prevent muscle soreness.
Yeah. And I think when it comes to injuries, one of the primary things is just when you have a spike in activity. So if you're starting out with a distance that is too much, maybe 15 minutes is too much for you to start with less than that. That is totally fine. Okay. So that might mean having a chair out in your driveway and shuttle walking back and forth, and then adding from there, add a few driveway laps each week. I think most importantly, it's just about starting. So wherever that might be for you.
Okay.
Thank you. I've got one question, actually. Just wondering, how do you know after you've started a new exercise routine, if you get kind of sore, how do you know if it's normal soreness versus like something you need to worry about?
We'll probably both chime in on this. I think muscle soreness is totally normal, especially when you're starting new activities. So that is one thing. You can expect to wake up the next day and be like, ooh, okay, I feel a little bit achy in certain spots. We usually look at, is that pain lasting? We'll call it pain. It's usually, discomfort. Is that lasting all the time? Or is it just when, you go to get up and you're like, oh, okay, I really can feel my legs a little bit. We want that. That means you did enough. Yeah. Okay. But if it's sharp or shooting, or you're getting like radiating pain,
or if you start limping, those are kind of signs that are, if your gait pattern has changed, those are signs that you might have overdone it, or if that's the type of pain that we're not looking for. But you can definitely expect to have some generalized muscle soreness that you might notice throughout the day, as long as it's not hindering your ability to walk.
And it should go away in a couple of days.
Yeah.
Great. Thanks so much, Brittany and Sarah. And just for everyone, if you need any additional information, go to the Rise and Walk page at risevermont.org. And we'll have a link to the Burlington PT website if you need to contact them for more info. And just remember to rise and walk for 30 minutes a day, at least 3 times a day this week as you work your way up. And you know, it's okay if you're taking your time and starting off slower, but the goal is to go for 30 minutes a day. Thanks a lot.
Thank you.